everyone, and welcome to another episode of Vega Insights. I'm Luke Beto, President and CEO of Vega Imaging Informatics. With me today is Quan Zhou from MD.ai, and we're here today to talk about radiology reporting. So it's clear to me, Chuan, that there are some major changes happening in radiology reporting. I've been in the industry now for quite a while, and I've seen radiologists doing reporting the traditional way for many years, and I've experienced all the pain points, the different templates that they try to come up with rules that are designed to have the right template come up automatically. And that's always a challenge. Sometimes the wrong template comes up or they just give up with it because there's so many variables to it that trying to design the rules makes it impossible to have the right template come up. And then once you do get the template in there, filling it out is always a challenge, navigating through all the variables. If you're saying next field with your voice or clicking around it, it just takes so much time and it's painful. And then, many radiologists have macros, little snippets of text that they try to put in. But if the study they're trying to read doesn't exactly match the snippets that they've got pre-built, then that doesn't really work very well. So they're trying to conform the study they're reading to their macros instead of just reading the case and stating their findings. And then there's the problem with impressions. They're having to kind of repeat themselves when they say all their findings in the findings section of the report, and they try to remember all the key findings and put them into the impression. Things are always getting forgotten, or it's just a waste of time to have to duplicate everything you're saying again in the impression. There's a lot of manual data transposition that happens, like with ultrasound measurements, for instance. The ultrasound measurements are maybe on a worksheet or they're reading it off of a screen, and they're just having to input all these measurements manually into the report, and it's just so painful. So many different challenges with the traditional way of reporting, and I'm really excited about this next generation of radiology reporting platforms. So I'm just wondering, what is it about these AI-powered reporting platforms that save radiologists so much time?
Yeah, absolutely. We've seen all the pain points you just described. And so very excited to have this conversation today. And yeah, and speaking of AI power reporting, at a high level, it really speeds things up by automating repetitive and non-diagnostic parts of reporting. Traditionally, radiologists spend surprising amount of time on things like finding the right template, filling it in, cross-checking prior reports, and summarizing findings. And all of these tasks can slow them down and take them away from reading more studies. And now AI-powered reporting can actually just capture key findings and format a report as the radiologist dictates in free form. And on top of that, there are just so many things that AI can do to help with at every step. For example, in our MDI reporting system, we can also automatically compare with prior reports and insert follow-up recommendations based on the appropriate guidelines and make sure nothing important gets missed. So the result is less time spent on these administrative work and more time spent on reading the images and engaging with the care team. And I think the best way to get a sense of how this kind of system works is to see it for yourself. So I would love to show our audience an example of a study read in MDI system.
Absolutely.
Now I'm going to share my screen. And so here I have a sample order that just came through, and you can see the clinical information. And this patient has shortness of breath and cough. Now I'm just going to dictate a few lines in freeform and let the AI do the rest of the work for me. Left lower lobe opacity, likely pneumonia. Small bilateral pleural effusions, left is greater than right. And within a few seconds, you can see the AI has pulled the correct template for me, from my existing list and mapped all the key findings into the right section. At the end, it also generated impression. And I like it, so I'm going to keep this and sign it off.
Yeah, that's slick. Now, this concept of utilizing AI to help transcribe the report, is it all kind of the same from one AI-powered reporting platform to the next? Like what you just did, are there certain things that are different, like from MD.ai versus some of the other ones that are out there?
Yeah, sure. There are definitely a lot of AI power reporting solutions today that sound pretty similar, but in practice, there are big differences. From my opinion, what drives our success is our focus on fitting into existing enterprise systems without adding friction, while also offering our users unique features that they consistently tell us they don't get elsewhere. So I'm going to highlight a few unique features that we have and show you how they work.
Great, yeah.
And so in any study, if you already have your prior reports in the system, on the right side, you will see a lesion tracking system that tells you the progression of every disease. So our users can easily visualize what have changed. They also give you a short summary under each section. And under the lesion tracking system, you can also access your prior reports. Like here's an example. And now I'm just going to let AI do the key findings mapping and also compare with the previous findings. Assume I already dictated my current findings. I'm just going to turn on this prior report comparison button and then trigger AI. Of course, you can also do all of these through keyboard shortcuts or voice commands if that's easier. Now you can see it inserted the prior study date and it's telling you how the lesions have changed in the impression area as well.
Okay, so let me make sure I'm understanding here. So this lesion tracking functionality, is that an add-on? Is that something you have to integrate with an AI, separate AI tool, or is that built into your platform?
Right, it is built in.
Okay.
Every user will get access to a lesion tracking system.
And it's getting the information about the historical lesion sizes from the prior reports?
That's right. Here,
Okay.
let me collapse this charts and you will see your list of prior studies in the system for this particular patient. And you can select any of the studies to compare with.
So the traditional way would be I would be looking at every single prior report and dictating into the findings and impression, what it was before and what it is now and how it's changed. But with this, it's pretty much just automatically doing all of that. I just have to dictate what the current measurements are and it's able to put it all together in the report. Is that right?
Yeah, exactly.
Okay. Yeah, that's really nice. So are there any other features that really stand out with MDA?
Yes. Now let's take a step further. What if I also want to include follow up recommendations by applying a clinical guideline? AI can help me with that too. So let's take a look at this thyroid ultrasound. In this report, I already have 4 thyroid nodules. I have their measurements and characteristics listed out. And here is the prior measurements. What I'm going to do is just select the TIRADS guideline I want to apply to this report and then trigger AI to do the key findings mapping like what I've just shown you and also give me the follow-up recommendations based on the changes of the nodule. So you can see it's telling me the points of each nodule and follow-up recommendations. Usually, radiologists may spend more than 15 minutes to complete a complex reports like this, but now with AI, you can get it done within a few seconds.
Yeah, that is amazing. Just saves you all the time of researching the guidelines, if you don't know them all off the top of your head, and then trying to transcribe them all in there is a huge time saving. So that's great.
Absolutely. And we allow our users build custom guidelines or just use the standard ones in our system.
Okay. That's awesome. Anything else you'd like to point out?
Yeah, now I'm going to keep this and also show you how we can use AI to calculate volume for these 3D measurements. There you go.
There's another one that, without this, I'd be trying to do these calculations either manually or through a third party software. And so,
Exactly.
yeah, that's another nice feature. Great. Anything else you'd like to point out?
Yeah. And speaking of these ultrasound studies, and also as Luke mentioned, it's always very manual to map the data from the ultrasound machine to a report. Now in the system, we can directly receive DICOM SR files with measurements and then map them into a template, which will save radiologists, sonographers, and technologists a lot of time in that process. So here's an example for this ultrasound study. We have received two different DICOM SR file. If I just want to map one of them into an existing worksheet or template, I just need to turn on this mapping button, and you can see um, it will quickly extract the numbers that I need and put them into the right fields.
Now, I'm familiar with kind of the traditional way of doing this with these DICOM router solutions that require admins to create all these mappings. I mean, you might need a mapping for a particular GE model, and maybe you have 3 or 4 different GE models, and then you've got some Samsung, and you've got some Canon. And then if anything changes, your mapping files need to get changed and all of that. So you're saying with this, you can basically eliminate all those mappings and the whole entire process. You just need to get the SR data over to your platform, and the AI can make sense of those SRs and put the measurement data into the radiology report. Is that right?
Yes, exactly. And this way, we don't have to manually connect with each ultrasound machine.
Right. Yeah. Because, I mean, for large practices or teleradiology practices, it could be hundreds of different ultrasound models. So to try to come up with mapping files for everything and always stay in sync, it's a monumental task. So, I mean, to me, this is a game changer for the ultrasound world. Definitely the way of the future. So that's awesome.
Yeah, yeah, definitely a huge time saver. Yeah, so there are a lot of AI functions you can add on top of your current workflow. And there's also a lot of innovation we've done around streamlining the workflow. For example, real time syncing is a big one. Now we can also allow our radiologists to sync reporting on a different device like your iPhone, a tablet, so that you can finish a report, make addendum anywhere.
Okay, so with this one, you're saying if I'm having problems with my speech mic or I need to finish this on the go, I don't really need a speech mic or power mic or anything. I can use my phone as my mic.
Yeah, that's a great point. And usually our iPhone mic probably works better than the traditional speech mic.
Yeah. Yeah, that's interesting. I'm sure some radiologists will find a lot of use for this type of feature. That's cool.
Yeah, for sure. A lot of our users love this feature, especially the users that are outside of the States. And speaking of our adoption overseas, we also added support for multilingual reporting. And this is an example of a Japanese report. And Canadian French is also a very popular one. So, yeah, it's really validated across a diverse user group.
So, Chuan, you're saying if I'm a radiologist and my native language is Japanese, I can work in Japanese and then it'll convert everything to English, or you're just saying that it understands the different languages and it can type the report in those languages.
Well, you can do both. You can dictate in your native language. You can also dictate in Japanese and let the AI translate into English.
Oh, okay. So it'll do translation, or if you work in a country where you actually want to create the report in a different language and save it that way, it'll do that as well.
Yes, for sure.
Yeah,
And
great.
yeah, it can be a potential benefit for a patient communication as well if you want to translate in the patient's native language.
Wow. So, I mean, it just seems like you have the core technology of, using AI to auto create the impression and create a nicely formatted radiology report. But there's so much more to it that, when you add up little time savers here and there, it really adds up to huge time savings. Now, to me, it seems like a pretty drastic change for the radiologists. I mean, if they've been using something like PowerScribe for the last 15 years and they've been navigating through templates, is it difficult to transition to this type of reporting platform, or what have your users said about the transition?
Yeah, that's a great question. We've also designed our system to make the transition easy. So users can choose between traditional template-based reporting or AI-powered mode, and they can decide when and how to use AI at each step. So the flexibility has really been the key to adoption. And of course, we also support the basic functionalities like macro and template import and custom workflows like resident workflow. So users don't have to change the way they are already working. They can just layer AI on top of their current workflow at their own pace.
And it seems nice that, at the organization level, if they want to move forward with this, some radiologists might want to start slow with the traditional way of reporting, and others might want to jump right into the full blown freeform dictation method. So that makes a lot of sense. So the organization doesn't have to force all the radiologists to do it one way at the same time, it sounds like. So that's always nice.
Yes.
So, I mean, the time savings side to this seems pretty clear to me. What about the clinical benefits? Can you speak to that side of, the importance of making a change like this?
Sure. Clinically, the benefits are really all about quality, consistency, and patient safety. Having the capabilities like automatically pulling structured measurements from imaging data and align reports with standardized guidelines like LIRADS, TIRADS, we can reduce variability and human errors, as you can see from the example earlier. And things like lesion tracking and the visual charts can help physicians clearly see how diseases have changed, which supports better treatment planning and more informed conversations with the referring doctors and patients. And lastly, I would say another really important piece is about AI powered proofreading. So we're proofreading the reports throughout the process of report generation. It helps catch common errors, any inconsistencies before report is finalized. So that not just prevents mistakes from slipping through, but also avoids delays in treatment decisions that could come from an incomplete or corrected report. So while it really speeds things up, it also frees radiologists from all these administrative work and giving them more time for clinical discussions, second opinion sessions, and even direct patient engagement. So we think over time, the combination of efficiency and quality will raise the overall standard.
Yeah, definitely. Well, I really enjoyed our session today, and it's clear to me the benefits that MDAI could bring to an organization. We're excited to be a part of it, and that is why Vega has partnered with MDAI, making it one of our key offerings under our Vega Tech division. So I'd just like to encourage everyone to reach out to us if they'd like to learn more about MDAI and strategies to make the change to AI powered reporting. Visit vegainformatics.com and you can learn a lot more about this technology, and we'll be excited to set up a meeting with you to talk more about it. So thank you for your time for attending our session today, and we look forward to having you on our next session.
Thanks, everyone. Thanks for having me.